Today we're diving into the musculoskeletal system. Bones, muscles, joints, tendons, ligaments, and everything that keeps us upright, moving, and hopefully fracture-free. This system does more than just let us walk and lift groceries. It protects vital organs, helps regulate temperature, produces blood cells, and even stores minerals like calcium and phosphorus. When something goes wrong here, the whole body feels it. The musculoskeletal system is highly integrated. When one part is injured, others are affected. For example, an infection in a joint such as septic arthritis doesn't just cause pain. It can destroy the surface of the bone and cause the surrounding muscle to waste away. Musculoskeletal disorders are among the leading causes of disability in the United States, costing nearly $1 trillion each year in treatment and lost wages. Arthritis is the most common culprit, with more than 54 million adults affected today, and that number is expected to rise to 78 million by the year 2040. As nurses, no matter what area you work in, you will care for patients with musculoskeletal complaints. The human skeleton has 206 bones. They are grouped by shape. Long bones, like the femur, have a shaft called the diaphysis made of compact bone, and ends called epiphyses, which contain spongy bone. In children, the growth plate drives bone growth, but in adults, it is calcified. Short bones are found in the wrist and ankle. Flat bones, such as the sternum and skull, provide protection and are key sites for blood cell formation. Irregular bones, like vertebrae and the jaw, have unique shapes that match their functions. Structure reflects purpose. Long bones handle weight and movement, while flat bones protect and produce blood cells. Bone itself is living tissue. It is made of 3 types of cells. Osteoblasts build bone by secreting the matrix. Osteocytes are mature bone cells that maintain structure. Osteoclasts break down and resorb bone. Compact bone is organized into osteons, each with a central canal for blood supply. Spongy bone is arranged in a lattice framework called trabeculae, which are filled with marrow. Covering the bone is the periosteum, a fibrous membrane that provides blood supply and attachment for tendons and ligaments. Inside, the endosteum lines marrow cavities and houses osteoclasts. Bone formation, or osteogenesis, begins before birth. Ossification is the process where collagen fibers provide resilience and minerals like calcium and phosphorus provide strength. Bone is dynamic, constantly remodeling. In fact, the skeleton completely renews itself every 10 years. Remodeling balances resorption or breakdown of old bone with formation of new bone. This process is influenced by several factors. Physical activity is essential. Weight-bearing exercise strengthens bones, while immobility leads to calcium loss and weakness. Diet is also critical. Adults need about 1,000 to 1,200 milligrams of calcium daily, and adequate vitamin D for absorption. Young adults require about 600 international units of vitamin D daily, while older adults need 800 to 1,000 international units. Hormones play major roles. Activated vitamin D, or calcitriol, increases calcium absorption from the gut and supports bone mineralization. Parathyroid hormone raises calcium in the blood by mobilizing it from bone, while calcitonin lowers calcium levels by encouraging deposition back into bone. Excess thyroid hormone, or cortisol, accelerates bone loss. Growth hormone stimulates bone modeling in children. Estrogen and testosterone also protect bone. Loss of estrogen, especially after menopause, accelerates osteoporosis. At the cellular level, osteoblasts regulate bone resorption through signaling molecules called rankle and osteoprotegerin, keeping bone turnover in balance. When fractures occur, bone regenerates itself, not with scar tissue, but by reforming bone. Healing happens in 4 stages. First, a hematoma forms within the first day or 2, bringing fibroblasts and new blood vessels to the site. Second, a soft callus of cartilage and fibrous tissue bridges the fracture. Third, a hard callus of new bone replaces the soft tissue, creating a firm union. Finally, remodeling occurs as compact bone replaces spongy bone, restoring strength. Healing speed depends on blood supply, immobilization, the patient's health, and age. Joints connect bones. There are 3 main types. Synarthrosis joints, like the skull sutures, are immovable. Amphiarthrosis joints, like the spine or pubic symphysis, allow slight movement. Diarthrosis joints, also known as synovial joints, are freely movable and the most common type. Examples include ball and socket joints, like the hip and shoulder, hinge joints like the knee and elbow, pivot joints like the radius and ulna, saddle joints like the thumb, and gliding joints like the carpal bones. These joints are lined with cartilage, enclosed in a capsule, and lubricated with synovial fluid. Ligaments stabilize joints, tendons connect muscles to bones, and bursae act as cushions to reduce friction. Skeletal muscles move the body, maintain posture, and generate heat. Each fiber contains sarcomeres, which contract when calcium triggers actin and myosin to slide across each other. Contractions may be isometric, meaning no change in muscle length, but increased force, like pushing against a wall. Or isotonic, meaning muscle shortens, like flexing the arm. Energy comes from adenosine triphosphate, or ATP, through aerobic metabolism when oxygen is available, or anaerobic glycolysis when it is not, which leads to lactic acid buildup and fatigue. Muscles with more myoglobin, called red fibers, contract slowly but powerfully. Muscles with less myoglobin, called white fibers, contract quickly. Muscle tone is maintained even at rest. Damage to the upper motor neurons leads to spasticity, while damage to lower motor neurons leads to flaccidity and atrophy. Muscles work in groups. The prime mover drives an action. Synergists assist, and antagonists oppose. For example, when the biceps flex the elbow, the triceps act as the antagonists. With paralysis, patients can sometimes retrain synergistic muscles to take over lost functions. Exercise strengthens muscles through hypertrophy, while immobility causes atrophy. Even during bed rest, isometric exercises like quadriceps tightening or gluteal squeezes help maintain strength. With aging, the musculoskeletal system changes significantly. Bone loss leads to osteoporosis, height loss, and spinal curvature. Muscles lose mass and strength, while joints become stiff. These changes increase fracture risk and may reduce independence. However, regular exercise, good nutrition, and positive lifestyle choices can slow these effects. The musculoskeletal system is more than bones and muscles. It is the framework of life, movement, and independence. As nurses, understanding its structure, function, and common disorders equips us to support patients across the lifespan, from encouraging weight-bearing activity in the young to preventing falls and fractures in older adults.